feel a twinge of pain or cramping in the middle of your menstrual cycle? It could be ovulation. I'm Nurse Heather, medical advisor with Premom, and today we're going to discuss why ovulation pain occurs, when to be concerned, and its relation to pregnancy success. So first things first, let's talk about what is ovulation exactly. It's the part of your menstrual cycle where a mature egg is released with the ability to be fertilized by sperm, leading to a baby. So in order for conception to occur though, you have to have intercourse during your fertile window, the only time you can get pregnant during your entire cycle. So this is the 5 days leading up to ovulation and ovulation day itself. In addition to using ovulation predictor kits, also called OPKs, you can watch for certain symptoms like ovulation pain. Ovulation pain is pretty common, affecting around 35% of women of childbearing ages. Those who do experience it often describe it as a sharp, dull, crampy sensation in the lower abdomen or pelvic region, either on the right or the left side. It doesn't typically last more than just a couple of days, and it does not increase in intensity. There's a couple of reasons believed to be the cause of ovulation pain. The first one being follicular swelling in anticipation of releasing a mature egg. So basically, your follicles grow, and they swell, and that can be a little bit uncomfortable. The second one being peritoneal lining irritation from the fluid that's expelled after the egg is released. So that peritoneal lining is the smooth tissue that surrounds your abdominal pelvic region. So having some extra fluid in there can be a bit uncomfortable. Though we know ovulation pain is common, it should not be unbearable. If your ovulation pain is hindering you from doing daily activities like getting in the car, going to the mailbox, walking up the stairs, something simple that you do each day with or without other symptoms like shortness of breath, heavy bleeding, painful intercourse, it's definitely worth reaching out to your doctor. You are always your own best advocate. So if you feel that something is not quite right, never hesitate to seek medical advice. With that being said, does ovulation pain mean you are for sure ovulating? Though ovulation pain in the middle of your cycle can indicate that ovulation is approaching or has passed, it's not a perfect guarantee that it is occurring. Remember those OPKs I mentioned earlier? Those in conjunction with watching for symptoms like ovulation pain can really give you a lot of insight into what is going on during your cycle. These kits allow you to measure the amount of luteinizing hormone, or LH, in your urine. LH is the hormone responsible for triggering ovulation to occur. So once these levels reach a certain threshold, what is referred to as your LH peak or peak fertility, it triggers ovulation to occur in 24 to 36 hours. This lets you time intercourse appropriately when you're trying to get pregnant. Sound overwhelming? I promise it's really not. The free Premom app lets you take a photo of your ovulation test with the in-app camera, and it interprets your results for you. It places it on a chart alongside any other data you want to include, like your period dates, and it keeps everything in one concise location so you can always refer back to it at the hand of just holding your cell phone. How easy is that, right? So when you're looking back, you can see the progression of your LH, and you know when you're most likely to ovulate. So easy peasy. Wrap it up, let's talk about the relation between ovulation pain and pregnancy success. So though ovulation pain around the time of ovulation can be a reassuring sign of fertility, in ovulation, not all women who experience a healthy ovulation have ovulation pain. So it's not really a reliable indicator of fertility health or how successful your chances of conception are going to be for that cycle. If you liked learning about your fertility health today, feel free to like this video, leave your thoughts and comments below, and never miss out on another opportunity to learn about your body and your fertility. Subscribe to our channel and we'll send you notifications. I'm Nurse Heather, medical advisor with Premom.